Okay, good evening, everybody. You have to excuse my voice. I've been happily singing at a festival all weekend and feeling rather hoarse. So, but anyway, good evening, everybody. I'm recording this video so that anybody who can't attend will be able to attend. And if anyone's got any questions through the this chat, send me a chat box and we'll do the Q&A at the end. So first off then, in a couple of weeks we'll be heading across to Morocco. I'm actually leaving on the Friday. I'm going to get over there on Friday afternoon. There's quite a lot to set up this year. There's things to sort out for the football tournament. I usually go a day earlier if I'm taking medical supplies, which I'm actually not doing this year. But I'm just going to a day earlier with the RIFCOM crowd and get everything set up. So I'll be heading over there on the Friday. And I'll be meeting everybody on the Saturday. So you've got, we've arranged for a minibus to collect everybody from the Tangier airport. And from there, hi Richard, we'll be, can you hear me okay? So from there, basically, we'll be heading to Chefchaouen, where we'll be staying in Chefchaouen for the first night. And then on the second day, or the first day for you, the second day for me, we're having a football tournament with RIFCOM. And the football tournament will be for around 250 kids. And we've been invited for the first time to set up a marquee and do oral hygiene, give out toothbrushes and spend some time with the kids on that day. So it's going to be a real great team building day. We'll also, at the site of the football tournament, will be opposite a school that's just been built by RIFCOM, and it's also the site of our first medical centre in Morocco as well. So there's a lot going on in that area for us at the moment from a charities perspective. So it's going to be a fantastic community builder for us to get in there into the community and help with oral hygiene. So that will be on the Sunday. On the Sunday evening, we'll be going out for a meal in Chefchaouen. And then we will be heading over to Khizana, where in Khizana we will be working for 2 full days at this school in Khizana village where we worked last year. Now, if you look on the Facebook page, there's a couple of videos that we shot when we were there 6 weeks ago, showing you the clinic and also showing you the accommodation that we're staying in as well, because I know that the amount of emails that people send across is always about, is the showers, what's the accommodation like, do I need a sleeping bag, all that. So I shot a nice video of it, and also there's a clothing list as well now on the Facebook page. So please use the Facebook page to get involved. Everybody who's coming on the trip is on the Facebook page, and it's a great way to get to know each other and have a chat before we go along. But next I wanted to talk about the patient journey with Dental Mavericks. I can see that Richard's joined us. So Richard, hi Richard. I'm going to unmute you in a minute, love. And if you don't mind just having a chat with everybody about our ethos and what our patient journey means to us and why we've got that patient journey and why it's pain-free. So if you just bear with me 1 second, Richard, I'm just going to unmute you. Okay, Richard?
Can you hear me?
I can hear you loud and clear. So, Richard, just tell the other Mavericks, reminders for the old ones and the new ones. What if I'm a child walking into Dental Mavericks? What is my patient journey going to look like?
Okay, so first of all, you'll be met by the local teachers. Usually help us out here by filling in name cards for them. So they have a small card on which they have their name, and they'll queue up to be seen by 1 or 2 of the dentists to screen them basically. So we're basically going to look into their mouths and the question we're asking them is, are they in pain? Obviously, we know a few Moroccan words, but we certainly don't speak Arabic particularly well at all, any of us. So through the translators, we're trying to establish whether they're in pain. That's really their consent. If they're not in pain, even if they've got really rotten teeth, they've not consented for us to do any treatment. And we'll write on the card then what needs to be done. So whether it's an extraction or whether it's fluoride. And from that, we will then divide them up into those which are having fluoride and those patients which are then going to sit and wait to have their painful teeth removed. Obviously, we then will take them through to the area which in where we're going in the RIF, it's quite tight. It's not a big room. We've got space up for, I think it's 3 chairs, is it, Callie?
Yeah, well, if you remember last year, where we had our lunch in the little teacher's house next door, we've got that as well this year. But in the main extraction area, there'll be just 3 chairs. Yeah.
3 chairs. Yeah. So there's 3 chairs. So they're quite close together. So trying to manage the children is really important, because 1 upset child makes 3 upset children. So we very much a hands-on. We sort of welcome them, pointed our names, which we've got printed on the front of our T-shirts, shake hands, lots of touching of their flat flesh. That's right, yeah. And you've got to remember is it's back to front, so they read from left to right, not right to left, which is, you're all going, oh, my name's Richard. No, it's not. It's Richard that way. So try and make it a bit of fun. We pretty much confirm with most of them. We ask them where it's hurting, and they'll point to a lot of them will be able to point to the teeth. Obviously, the very ones aren't necessarily quite so able to join in. But we use topical anaesthetic just as we would do in the UK. We're going to give that a good while to work before we freeze them up as painlessly as we can, and that's absolutely critical. It wins trust. That those that have seen the dentist have generally had a bad experience outside, and those who haven't had teeth taken out have never had an experience with the dentist. So I think it's absolutely critical that we make that experience probably the best it can ever be. Yeah. Because hopefully we're going to be going back there years, and what we want them to do is to build bridges with them, so that long term we can actually start to make improvements. And certainly we've seen that in other places where we've been going back a few years, where we come back and yes, they might still have teeth that need taking out, but the sites that we've dealt with are now healed, and they've not got loads of septic areas in their mouths. So all the way through, it's very much hands-on. We'll look after you. You've got to use all of your non-verbal communication, because you're not going to be able to talk to them, to make it fun and get them as relaxed as possible. Having your teeth taken out is never the most pleasurable experience in the world, but if it doesn't hurt, they will get on with it. Okay. And I have to say, the kids generally are absolutely amazing. They're nothing like the kids you have in the UK.
Right.
Obviously, once we've got the tooth out, we then obviously stop the bleeding and move them through to a triage area where, give them a present, and they're looked after, and invariably, off they go, and they're fine.
So what would you say in terms of equipment? Because I've had quite a few emails this time as well on what's the equipment like from people obviously being generous and wanting to bring things in case we don't need them.
Yeah. I have to say, I probably won't be bringing anything unless you've got a favourite luxator or something like that. Then, to be honest, the amount of kit we've got now is phenomenally good. To be honest, I wish I had half the quality of the equipment they've got. Some of the forceps are particularly good. So, you've got the full range of deciduous and adult forceps. You've got some luxators. You've got certainly loads of Couplans, 1 to 3. You've got cryers now. there's not much we want for really. In terms of extractions, you know, I can't see. The thing that you will need is bring a headlight. You know, we haven't got overhead lights, and you haven't got amazing suction. So the one thing that you need is fabulous visibility. So you know, pack your loops, pack your headlights. If you come in as a nurse, pack a Walker's headlight will help. You know, as you're looking in there, then you know, the more light we've got, the better, basically.
Brilliant, thank you for that. And just in terms of again, because with Mavericks, we're always looking for long-term relationships, and that's why we go back to Khizana, because we want to get as close into the community as possible. So I've just popped up onto the Facebook page if anybody would like to bring a gift from their local town or village, just under £10, nothing expensive. Might be a jar of jam or some biscuits or something, just so that at the end we can just give them something and give them a little bit of sunny England, so to speak. So, and also to ask whether you could also bring any toothbrushes or toothpaste. We're waiting for 2,000 toothbrushes to come from America, and we've just taken delivery of 1,000 toothbrushes. But if you remember now, we've got 2 quite large projects that we need to supply for 12 months. So we need as many as we can get, and toothpaste is always something that we never have enough of. So again, even if you can cram 100 tubes in your backpack or 50 tubes, just whack them in and bring them. And the other one thing that we always have to pay for, which is a big expense is fluoride. We always take the fluoride out of the cost of the trip for that specific trip. And the more children that we see, obviously, the more expensive the fluoride is becoming. So if anybody's got any connections, we've got some donations from Voco. If anyone's got any good connections with fluoride reps or fluoride companies, either introduce me to them or introduce one of the trustees to them, so that we can start to build some relationships. And we're always happy to help with the marketing and help with you know, leveraging that donation as much as possible throughout the Facebook pages and throughout the newsletter and annual reports. And then just for the nurses, if there's any new nurses coming, there's a fantastic story on the Dental Mavericks website that Julie Richardson Julie Foster wrote 3 years ago. She was a lady who came through a competition through a dental magazine, and she wrote a great blog and story about her journey as a nurse. So if you've got any nervousness, or you're worried about anything, or you just want to read what is it actually going to feel like and be like, then just have a read of that. And then just really for Q&A, I've just got a couple of Q&As that I've had emailed through, which I'll just quickly pick up. So Katrina had emailed me because she can't come on the call today. So one of her main questions was, what footwear would we wear for the clinic sessions? Well, for the clinic sessions, everybody will receive a T-shirt. Mavericks will also, older Mavericks will have T-shirts from before, and I always bring plenty of spare. So it's basically a comfortable T-shirt that you'll be given, and really to make the day as comfortable as possible. So, you know, I wear flip-flops, or I'll wear my Converse trainers or something that I know I can wear for 12, 14 hours, walk around and my feet aren't going to hurt. So don't be worrying about buying any new shoes or anything like that. Just wear something that's going to protect your feet, and also that's going to keep your feet clean, I suppose, as well. Also, I've been asked about malaria. There's no chance of malaria in the Rif. The only place in Morocco that has any chance of malaria is in the Sahara, and we're not going anywhere near that. And I've been a few times and I've never taken malaria tablets. Phone connections, I keep asking. I've had quite a few emails about, sorry, my screen's gone off, hang on, about phone connections. Your phone connection will be intermittent when we're actually up in the mountains, but we are going to be spending 2 nights this time in Chefchaouen. So generally your phone connection is pretty good. And to be honest, Richard, we've trekked all over the mountains, haven't we? And we've still had a phone connection in the most obscure places.
There's internet in the world over there.
Yeah. So I think really, it's a yes, I think. Internet, not as much. We won't have internet, and I wouldn't advise that you have your data roaming on your phone at all. We won't have Wi-Fi up in the mountains in Khizana. So there will be 2 days where you have no Wi-Fi, but you will have a phone connection. There will be showers in all the accommodation that we're staying in, and you won't need sleeping bags this time. Jenny and Katrina have also said that they're going to bring some colouring pencils, toothpaste and toothbrushes, which is great. So anything, I know Andy Nourish last year bought some football magazines, which were great to give out at the end. So if there's anything that you want to bring that you want to give out specifically on your own, that's absolutely brilliant as well. We do bring some toys to hand out, some pencils and colouring stuff. And then Katrina's also offered to bring some great, or give us some great images for dental hygiene, oral hygiene training as well. So any ideas that anybody's got for that day with the football team, there's going to be 11 teams there, lots of kids, and lots of families, I'm hoping as well. So it's going to be a real great day for us as Mavericks to really get in there and just focus on that oral hygiene, because I was speaking to Jill Fisher from Castle Park the other day, and we really do need to. The days are so busy when we're doing clinical, is sometimes we just don't get that chance to spend enough time doing it. The other thing to mention on this trip is that we've got some students coming between 16 and 18-year-old from a school in Marbella, and they all speak French, and one of them is an Arabic speaker as well. So they're there for one full day on the Monday. So they're going to be helping us on that day. So if we can get some sort of slickness together on the oral hygiene to work on the clinics, that'll help us long-term assist them. We've got all the resources, it's just we just need to be better at it, I think. Well, that's going to be great as well from the Sunday as a learning day. So I don't know if anyone's got any more questions. I know I've seen Claire's come on. If anybody's got any questions, just whip them into chat as soon as you can. Richard, have you got anything else to add to what we've been chatting about?
No, I think that's pretty much covered it, really. It's a fairly relaxed affair in terms of, you don't need any evening.
You don't need any what, sorry?
Don't need an evening dress or anything like that.
No.
It's very relaxed. So it's, and it's pretty dusty, so don't bring your best stuff.
Yeah. I think for the women, I think if you can just really, we've had lots of different people come to Mavericks and dressed lots of different, but my take upon it from a women's perspective is that if you dress similar to, I don't mean you have to wear a headscarf, but if you cover your t-shirt level and cover below your knee, you're always going to get much more respect and much more connection with the women of Morocco, because they're covered completely. So just bear that in mind, and dress comfortably, but always cover up to the elbow and to the knee is what I always advise to women. And that's it, really. We're really looking forward to seeing you in a couple of weeks. Use the Facebook page for as many questions as you want, because that's what it's there for. If anybody's not got any more questions, then that's it. But feel free to be in touch. And Richard's, as you already know, if you don't already know, Richard's a trustee of Dental Mavericks and has been for some time. So again, he's always available on the Facebook page. Chris is as well, and also Jazz, who's a new trustee. So please, if there's questions that I can't answer that are clinical or based around the actual work, just feel free to whip them up on the Facebook page, and we'll get them answered for you.
I think the other thing when it comes to the clinical side of things is don't struggle on. We're all here to help, and we're also not here to judge. So a lot of dentists have never actually worked so closely with other dentists, sort of in the same room, or there will be times when either you'll be looking over our shoulder, or we might be looking over your shoulder. That might only just be to add a bit of extra light. But we're all there as a team, and I have to say that's the one thing that is amazing, is that we can all work very much together. And I know that I certainly remember Jazz at one stage. He had a really difficult tooth, and of course we've got no X-rays. You don't really know you've got a difficult tooth until you've tried to wobble it out for half an hour. And sometimes you as a clinician, you're just absolutely knackered trying to get that tooth out. So don't feel like you're letting yourself down by saying to somebody else, can you have a look at this for me? Because sometimes that's the best decision you're going to make for that child. So we're just grateful that you've given up the time to come out and help us, and without you we'd be treating less kids. So if we can help, just give us a call and we'll help, and it might well be you helping us out.
Brilliant. That's great. Thank you, Richard. Okay, well, thank you, and we'll see you in Morocco. Okay, see you later.
Yeah.
See you.
Thanks, Kelly.
Love to chat. Bye.
Yes. See you at the weekend.
Bye. Oh, yeah, see you at the weekend. I forgot. That's come really quick, eh? My God. See you at the weekend.
Yeah, indeed. Take care, Kelly.
Darling.